Hi, this is Priyanka Goenka, a certified nutrition consultant specialized in fertility, pregnancy, postpartum, and child nutrition. I'm also the founder of the baby food brand Hungry Mums. In our podcast series of Wellness Whispers with Priyanka, I have a very special guest with me today, a doctor who has been acing his field since the last 20 years. He is a gynecologist, a laparoscopic surgeon, a fertility specialist, and the director at Renew Healthcare. He's not only been my doctor, but everyone's doctor whom I know around me. It's an absolute honor to have Dr. Rajiv Agarwal with us today to share his insights.
Hi Priyanka, thank you so much for having me here.
Completely my honor, sir. Okay, so Doc, I have been working in the space of fertility nutrition since a long time, and it's the month of fertility awareness. So that's the entire reason why I thought I should get you on the show, because there's no one better. There is a very sensitive topic that I want to touch upon, which is egg quality. I really want to have an opinion from your end and the audience to know, so that women out there have a clear insight, because it's all very haywire. There is a lot of information out there which does not matches the reality and the facts that we actually read and hear from specialists. So first and foremost, actually what is egg quality?
So that's a bit of a tough question to answer because unlike an embryo, which is formed after fertilization of an egg with a sperm, where you can actually do a biopsy, you can look at it various ways and try and test the quality of it. There is no test for egg quality other than the embryologist looking down a microscope at the egg and say, as per the norms or guidelines, this egg looks good or doesn't look good. So unfortunately, there's no one test which can correctly tell you what is the egg quality.
As a fertility specialist, can you please tell us a little more about egg quality? As in, is looks the only criteria, or there are other parameters that you would look at when you test the egg quality?
So as I said, looks is how we colloquially look at the egg quality, but of course there are various stages and parameters that you keep sort of indirectly looking at egg quality with. For example, the follicle when it is forming and you're doing an ultrasound, is the follicle of a good size? Then we do Doppler of the follicle during an ultrasound and say, is the vascularity or the blood supply around the follicle good? If the blood supply is good, the follicle probably is good. During an IVF, when we manage to collect an egg from a follicle, we say, okay, one follicle, one good egg. So probably the egg is good. Now, as I said, under a microscope, it is seen as to what it's looking like. If the egg fertilizes well, it's a good egg. If after fertilization the embryo grows well or cleaves well, as we call it, there is cell division happening, then we say that the egg might have been good. If it forms a blastocyst, it probably was from a good egg. If the pregnancy happens, we would say it's come from a good egg. But then, as we understand, from the point of fertilization, the sperm also comes into play. So it's not really the egg alone, but this is probably how indirectly you could go back and say, maybe the egg was good quality.
They say women are born with a definite number of eggs. So can you highlight on that, and can you also tell us if it's related to age?
So women are born with a finite number of eggs, about 1 to 2 million at birth. But even at puberty, before which ovulation hasn't even happened, at puberty the girl is left with only 20% of the eggs she was born with. From there, ovulation starts, and every month she loses about 1,000 eggs. At the age of 30, she has only 6% of the eggs she was born with. At age 37, she only has 1% left. So that's how dramatically the eggs start to come down with age.
I don't think a lot of people know this.
Know this, yes.
In other words, you mean to say the biological clock is real?
Biological clock is definitely real, and definitely more real after the age of 30.
How is this decline of eggs as per age determined?
So it's genetically determined. So every woman has this algorithm built inside by God, nature, that okay, you are born with so many eggs, thus you will lose so many eggs per month, per year, and so you will lose all your eggs at this particular age and achieve menopause. So that's more or less genetically determined. But there are a lot of extraneous factors which can probably hasten this thing. Surgery, diseases. I'm sure we'll be talking about these things as we go along in the podcast.
Okay, Doc. So, keeping egg quality aside, what is ovarian reserve? This is one term that everyone who's going through an issue related to fertility hears this, and women are so blank about it.
Yeah, so every patient is told that you have a so and so ovarian reserve, good ovarian reserve, bad ovarian reserve. So ovarian reserve is really the number of eggs that a woman will have at any particular time. The total number of eggs that she has, which can be used for pregnancy, fertilization, and so on and so forth. That's what we call as ovarian reserve.
And how do we test this reserve?
So there are two very robust tests for ovarian reserve. One is a blood for AMH, or anti-Mullerian hormone. This blood test will tell you what your ovarian reserve is like. A good ovarian reserve would be 2.5 and above. Of course, it also varies from lab to lab. Another way of testing is to do an ultrasound, a vaginal ultrasound, on the second, third, or fourth day of the periods. And we can actually count the number of eggs in the ovary, what we call as antral follicle count. We usually try and correlate the antral follicle count with the AMH values and try and arrive at an ovarian reserve figure.
So, do low numbers of AMH and AFC means the quality of eggs is also bad?
If you had asked me this question maybe 5 years ago, I would have said low AMH not only means less numbers, but the quality of it is also extremely poor. And that's what we were telling patients. But in the last 4 or 5 years, extensive research work has been done, which has shown that if the AMH is low, the numbers are low. But if, say, someone has only 4 eggs and someone else has 20 eggs, this A lady's 4 eggs and the other lady's 4 eggs would be absolutely equal in quality. So it's the numbers which go down. The quality does not really change between these two people who have low AMH. Quality really only goes down with age and certain other factors.
And what are those factors?
A lot of those factors which can change the quality of eggs. Medically, from my end, surgery. So if someone has a surgery on the ovaries, the quality and the numbers both would go down.
When you say surgery, what kind of surgery?
So say, for example, someone has polycystic ovaries and the doctor has decided to do a laparoscopic ovarian drilling. It's a very common term. A lot of patients undergo that. But when you undergo a laparoscopic ovarian drilling, since the ovaries are burnt in some way, the numbers go down dramatically. Say someone has an endometriotic cyst, a chocolate cyst in the ovary, and that chocolate cyst has to be removed from the ovary. In the process of removing it, some part of the ovarian tissue is also lost, thus the numbers will come down. So these from my end, medically would kind of reduce the numbers. But I think this question should be thrown at you, because I think as a nutritionist, you people become more life coaches, because you have to look after the mental health of the patient, the physical health. You have to tell them to exercise, not exercise, gym, slow walk, etc., etc. And of course, you have to look after their diet. So as the custodian of the lifestyle of patients, what is your opinion regarding lifestyle changing egg numbers or quality?
Doc, nothing, as you mentioned, nothing really can change the egg numbers in terms of increasing them. The numbers only decline with age. What we can actually work on with diet and lifestyle, as you mentioned, is the quality of eggs. So say if someone is really wanting to influence the egg quality, it is said that they need to work for at least 3 months in prior to conception, or even if undergoing any assisted treatment like an IVF or an IUI, however, whatever mode of conception they choose. So,
So,
3 months.
so you mean to say that a patient or a couple should come to you at least 3 months prior, because that's what we fertility specialists also talk in terms of giving a folic acid or investigating. But I think in terms of lifestyle change also, it should be at least about 3 months.
Definitely. In our nutritional world, we are always said that a woman, when she's trying to conceive, should eat as though she's already pregnant. It's not that when you already have the baby is when you start taking care of it. You have to get your body ready for it so that you're ready for that conception.
When these couples come to you, obviously we talk to everyone about weight, but I think what people need to know from a nutritionist's perspective is, how important do you think is weight, and how should one lose that? Is it diet? Is it exercise? Is it a lot of exercise, you go to the gym, you work out and you lose weight, or is it more focused on the diet bit?
When we talk about weight loss, it's diet and lifestyle both coming together for the changes to happen. A healthy weight or a balanced weight is extremely important for a healthy pregnancy to nurture. But when I say this, I don't mean that you start working out from tomorrow, hit the gym, do rigorous workouts, because that's not gonna help. Overworkouts are as bad as underworkouts. So your workouts also have to be planned that way. Now there is from the diet perspective, there is a lot that can be worked out on. And also one thing that I've really seen that works wonders is taking control of your stress levels. People don't know and they don't understand how stress plays a major role in the entire play of this conception. It is so difficult for a woman who's not stressed about things and is happy. For her, conception I've seen is much easier. Dealing with things is much easier rather than someone who takes everything too much at heart. So mental health plays an equally important role.
I think you brought out one very important point that I would like to reiterate, is that egg numbers can't be increased. They can only keep going down. But by not doing bad things, you can slow this process of it going down, so to say, but you can't actually increase it. What you can improve is probably the egg quality, and weight is so important from our perspective also. We do IVF, patients fail IVFs or they come back with miscarriages and they say...
Have you actually seen that weight plays a very important role when it comes to miscarriages and conception?
Absolutely it plays, and that is what the evidence says as well, that recurrent implantation failure in IVF, the first point in any literature is the woman has to lose weight. Everything else being all right, if your BMI is on the higher side, you will have lesser eggs, poor quality, poor fertilization, poor implantation, and higher risk of miscarriages. Not just that, sometimes making these patients understand is very, very difficult that all these things can happen. We tell them from a cost perspective that if your weight is on the higher side, you'll require more injections, your cost will go up. So if you lose weight, your cost is going to come down, and sometimes that hits them much better than... It's just about not accepting that you also have to make an effort to get into the success mode.
I agree. When they come to professionals, they expect that everything will be taken care of instead of putting in the efforts that's actually required.
Yes.
Honestly, Doc, what I have seen, fertility is a puzzle. We have to, egg quality is a very important part of the puzzle, and when we come to that egg quality puzzle, there are dividers in that, and to complete the puzzle, we have to actually fulfill each and every requirement, otherwise it's an incomplete puzzle always.
Absolutely. Now, luckily, despite India also becoming westernized and more youngsters smoking, luckily majority of the women in our society, even the young girls, don't really smoke. But a new fad, shisha and hookah, have come in, which of course we keep shouting from every treetop. But what is your stand as a nutritionist, or do you tell people, do they confide in you in that?
It's a big no-no. Smoking is definitely a big no-no. In fact, the other day I was consulting a patient, in fact your patient, who came to me asking, I need to conceive. After 2 months, I want to undergo an IVF cycle. You give me the healthiest diet. You tell me whatever I need to do. Okay, everything is going very smooth. After 15 days, when we had a follow-up consult, I asked her what's going around, and I just kept questioning so that I get as much details as possible. And then she came up with the topic that Saturday night I was partying, so I did not follow the plan. And then she, people kind of forget that this is also an information that they need to give. And then she said that I had this alcohol. I was like, you can't be on alcohol, you are planning to conceive. And then again I had to bring up the same point and explain to her that you have to eat as though you're pregnant. You can't be drinking, you can't be smoking, at least for the next 3 months. You have to be away from it. And I don't know if I'm allowed to say this, in many ways sacred, if I can call it.
See, I think that's right, because we already have so much of pollution around, and the food, adulterated food, etc. So at least the things that you can avoid and not mess it up more. So in terms of hookah and shisha and smoking and alcohol, probably makes sense. And in this case, as I always say in all my interviews, podcasts and videos, men have a huge role to play. Yes, it is true that smoking, drinking and hookah, shisha will make the sperms bad, but if nothing else, do it to support your wife, because she's the one who has to go through everything. So maybe this is the small little sacrifice that you can make from your end to participate in the entire process.
So correctly said, Doc, because somehow I don't know, it's the women carrying the child, or what is the concept behind it? Somehow this entire fertility thing, the onus is always on the women. Always on the women. Even if it's the man facing the trouble, the onus will come on the women. Why? Like, still, even in this generation where the stats are clear, where the reports clearly say everything, why is the society still like that?
I know, that's the difficult part. In fact, I feel a little bit of a victim as well, because I feel the onus is on the woman and the onus is on the fertility specialist. Why did it not happen? And it's very difficult to make them understand that, look, I did my part as well. But you know what? I mean, the BMI has to go down and the sugars have to get controlled, and something has to be done from your end as well. So that brings me to one more topic. Again, I'm treading on very dangerous grounds, but as a woman, one can't live without makeup, the nail polishes, the lipstick, and all the other stuff which I don't even know about. And you will have to cook in the non-stick cookwares, and you have to use colognes and perfumes and stuff like that. So what is your take as a nutritionist on these endocrine disruptors and forever chemicals, as they're called?
Doc, see, you can't stop living life. Here as a nutritionist, when people ask me these questions, I have very strong clarity that do whatever you can. Things that you can't do. It's not like every woman will wear makeup early in the morning and go out. It's like you're going out once in a week or twice in a week and you want to wear makeup, to be sensible enough, look for good quality, and you can get that. The point is, the things that you can draw a line at. Now you need to choose your battles. You need to know where you need to draw your line and where you can't stop. So I understand this is a very big thing, but I also understand that you stopping and depriving yourself of all the little joys in life is very difficult. So you are living in a world full of opportunities, and you have the world at your feet. Choose what you want to go with the flow.
So probably if you want to indulge in this, probably you could say, okay, you know what, I will exercise well and I will eat a healthier diet to kind of offset all the other little negative things in my life.
Absolutely. I am a huge advocate of getting that sunshine. Especially we Indians, we are so blessed with such a beautiful sun that this is something I tell each and every person that I meet, not just clients, but everyone. go get that sunshine. You don't know how much wonders it can do, not in terms of, re-energizing your body or getting that vitamin D, but it also supports your mental health. It helps you with your mood swings. It helps you with your hormone health. There is so much
Positivity it would give
a
you.
lot of positivity, and the fertility journey actually gets better.
So, if you were to advise one supplement to patients who are trying to conceive or who have poor ovarian reserve or less egg numbers, what would that supplement be?
Omega 3, for sure, no doubt about it, because maximum people have a deficiency of omega 3. We don't really get to test it ever. Plus, there is evidence which shows that omega 3 has positive benefits on the entire conception journey, not just for egg quality per se, but even men should be taking omega 3.
Omega-3.
Yeah.
What are your other favorite supplements usually?
So, in terms of antioxidants, there are 4 antioxidants that I really like to work upon: vitamin C, vitamin E, selenium, and zinc. These are the 4 actually, in nutritional language, the kata dhata of fertility. So, yes, these 4 supplements for sure. But I know, Doc, that you also give that POR cocktail. It's been 2 years that I've been working with you, so I know a lot of insights of how you work. So there is a cocktail POR that you hand over to all your fertility patients. Can you highlight a little more, as in why is it beneficial? How does it play a role in the boosting the egg quality?
Many years ago, when I was trying to understand why is it that young women have lower number of eggs, or even women with a decent ovarian reserve are having poor quality eggs. So that is when I chanced upon a lot of literature which said that because of the negative effects of these endocrine disruptors or forever chemicals or environmental pollution, a lot of reactive oxygen species are generated in the body. And to cut those, the role of antioxidants come in. And that is when I started using this entire cocktail of multivitamins, wherein we give, as you said, vitamin D, vitamin E, vitamin C. Coenzyme Q10 is supposed to be one of the world's most powerful antioxidants. And people, kind of talk about the antioxidant in red wine, that if you have red wine, you'll have that antioxidant which protects your heart, not realizing not every red wine has that antioxidant, and you probably have to have barrels of it to get that much. But resveratrol is the extract from those grapes, which is again a very powerful antioxidant, and I absolutely love it. Not just for women for improving the egg quality, but even for reducing or preventing DNA damage in the sperms. Resveratrol is absolutely good. Along with that, we use L-carnitine and a host of other things as supplements to improve. And I've seen a lot of benefit giving these to patients.
Okay. Leaving aside the supplements and antioxidants that we've been talking about, medically, is there anything else that improves the chances of getting a better egg quality if someone's undergoing conception?
Well, there's no guarantee. In whatever I'm going to say now, there is absolutely no guarantee that it works. But as long as you understand that there is a lot of evidence out there, and a lot of clinics, a lot of doctors have found fantastic results, including myself, but I can't generalize it to every single patient. So one of them is PRP. Women are using it for, facial rejuvenation, hair growth, and better skin, better hair, and everything else. People are using for recovery from sports injuries. We're using the same injection of PRP in the ovaries, and we've had some amazing results. So that's one. It's been shown that if you give testosterone supplements for months, 2 months, 3 months, the ovaries become more sensitive to the existing female hormones. So again, we give a lot of testosterone supplement for short duration of times. I do believe that a pregnancy is important, irrespective of who helps in bringing about that pregnancy. So as an allopathic specialist, I do understand the importance of a nutritionist. At the same time, I understand the importance of alternative medicine. So I work with acupuncture specialists, acupressure specialists, homeopaths, So I feel all of them, through their knowledge and years of training, always have something good to add. And as long as the pregnancy is achieved, it doesn't matter whether it comes from one person or a team of people jointly working towards it.
Absolutely, Doc. Doc, there is one question that I had. You just spoke about giving testosterone to females. Now, there are a lot of women who will have fertility issues, especially with PCOS. Now, with PCOS, also do you suggest that one should take
So,
testosterone?
Priyanka, this is a very common phrase that I keep using all the time in a lot of my lectures, that you having a gun is not good enough unless you know how to fire it. So that is what comes with this as well. A woman with PCO would already have excessive testosterone or excessive androgens in her body. It's an absolute no-no. Unfortunately, we do see a lot of prescriptions with DHEAS being given to women with PCOS, thinking that the bad egg quality of PCOS is coming from there and giving extra testosterone would help, which is absolutely wrong. It's never to be done.
So, no testosterone for
PCOS women, never.
Okay. Now, there is another question that I have. Endometriosis, or something that's really coming up. It's new or old, I don't know, but actually coming up in women. Now the thing is, it's difficult for them to get pregnant, at least not naturally. And there is a lot, again, from the perspective of diet and lifestyle, there is a lot of work that people with endo will have to do. But suppose most of the audience, as we know, is not really aware, and there's still a lot of awareness to be spread. So what is your take on that? How do people with endo actually improve their egg quality? How do they work towards it?
I think the one mantra that I have for women with endometriosis is, the moment you discover or you feel that you might have a problem, go to a fertility specialist. Listen to the fertility specialist as God's word. Work with other therapies like going to a nutritionist, yoga, because there are so many people who swear by that yoga took away my endometriosis and I was much better. Point well taken, do that. But the focus needs to be that endometriosis with age is going to reduce your egg numbers. It is going to reduce your egg quality. And while you're maybe depending on Dr. Google or the well-meaning advice of a whole lot of people saying, बेटा अभी तो young हो, क्या करोगे जाके, कुछ दिन देखो, naturally try करो, you might just be losing out on a lot of time. I'm not saying that people with endometriosis do not get pregnant naturally. They can. But the ones who don't will probably have lost so much by then that even an IVF may not be able to help them. Which is why I said, go to a fertility specialist, discuss your concerns, draw up a plan wherein there is natural conception, there is IUI, there is IVF, every sort of treatment built into it, and you're in a structured, protected environment where he or she takes you forward to your pregnancy. I have a question for you now. So, there is a lot of, we've spoken about diet and diet playing a role in our general lifestyle, weight, and even fertility. Now, we keep reading about diet making fertility better. So, is there like a Japanese diet where you take this particular Japanese diet or Moroccan diet and your fertility becomes much better? Is there a diet like that?
Honestly, Doc, yes, there is. And trust me on this, there is so much evidence of Mediterranean diet being connected to high rates of fertility, like improved chances of pregnancy, reduced chances of miscarriages, better health, everything. It's a Mediterranean diet, not just from the perspective of egg quality, but semen quality. Overall, boosting fertility journey, it's so important. And you know what Mediterranean diet is actually?
I was just going to say that. I was itching to say that for nerds like me who've never been into the kitchen, could you just give me an idea about what comprises a Mediterranean diet?
Basically, a diet which is high on vegetables and fruits is majorly known as Mediterranean diet. I don't want to get into the details of it, but it's said that 2 to 3 servings of fruits in a day and 5 to 6 servings of vegetables in a day is a must have if you are really looking to boost your egg quality journey. Now, since we've touched upon every aspect of diet, lifestyle, medicine in terms of egg quality, now there is something that we all read upon all the time, and as a nutritionist I completely believe in it also, that sleep plays a huge role. In my nutrition language, we definitely promote good quality of sleep, at least 7 to 8 hours. In the medicine world, does sleep play an equally important role?
So I think from, as you said, from your diet perspective, metabolism perspective, it plays a huge role. But I think medically, there are two things which sleep can do well for you or bad for you. If you don't sleep well, your body is stressed. And we know that increased stress levels will reduce your fertility. That's a simplest way of associating sleep and stress. But more important, medically, and I forgot to mention one favorite supplement of mine which I give to everyone who has poor egg quality.
I know.
Melatonin. So melatonin, again, we use for jet lags, and melatonin has been shown to improve the egg quality. And when does melatonin get secreted? When you sleep.
Yeah.
So if you don't sleep, or if you sleep with your lights on, you don't sleep in a very dark kind of an environment, your melatonin doesn't get secreted. So there is a direct correlation of no sleep and poor egg quality.
Doc, can you sum it up for the audience so that they have a clear picture? Let's just sum it up for them, as in to improve the egg quality. What are the things that they should be doing medically?
I think the most important thing for people to do is please come for preconception counseling. When you get married, whether you're intending to have babies or not intending to have babies, go to a fertility specialist and have a discussion. And from there, what we do is, amongst other things, work with your lifestyle, refer you to nutritionists, and of course, do your testings for ovarian reserves and sperms, etc. And when we do find that such problems exist, the first thing again is change your lifestyle first. So they will be coming to a lifestyle coach like you, looking at their weight, the diet, and stopping smoking, etc., doing all of those things. And only once they have been done and not given results, do we come back to the medicines and the PRPs. But lifestyle and antioxidants, I think, are brilliant.
Thank you so much, Doc, for sharing such an insightful experience with us. I have so many takeaways with me. I am sure the audience will have too. It was, in my terms, it was an amazing conversation to have. Looking forward to many more.
Thank you so much, Priyanka, for having me on this podcast of yours. I think it's a great honor for me. And it's always a good thing to try and put out information to everyone, where everyone learns and everyone grows.
Thank you, Doc.